Also known as spotting, having brown discharge before periods can be worrisome to women. Spotting comes in form of a light vaginal bleeding that occurs during other times than the time of period. It is reasonably common to have spotting between periods, and in most cases, it is due to hormonal changes and implantation bleeding. When the newly developing embryo rests and embeds into the uterus blood-thickened lining, a woman is likely to have brown discharge occurring between periods. If you are noticing bleeding outside of your normal menstrual cycle, it could be spotting. The spotting may appear as red, pink, or brown discharge that is noticeable in the underwear or on wiping. There are many reasons a woman can have brown discharge or spotting. However, when it occurs in the week preceding the period or what is known as the luteal phase, it is mostly associated with hormonal fluctuations. Having brown discharge before periods can also occur as part of the healthy menstrual cycle. In some women, this kind of spotting takes place consistently within every cycle. However, for other women, they may have premenstrual spotting occurring sporadically. Infrequently, spotting before period can be a sign that you have low progesterone levels. In order to understand the causes of brown discharge before period, it is crucial you know how things happen hormonally during that point in a woman's menstrual cycle. During period, a woman's body sheds the uterine lining. After the end of period, the uterine lining begins to build back up. Estrogen hormone increases after a woman has had her period, and it is responsible for the formation and growing of the uterine lining that had been shed. At the midpoint of a woman's menstrual cycle, there occurs ovulation. During this time an egg splits out of a follicle within one of the woman's ovaries. The spent follicle then transforms into what is known as corpus luteum that secretes progesterone. There is a drastic change in hormonal levels that occurs during ovulation. For example, estrogen drops while progesterone increases. Progesterone has a function of offering structural support to a woman's uterine lining. So if you have the corpus luteum secreting sufficient amounts of progesterone, the uterine lining will remain attached to uterus. The secretion of progesterone from the time of ovulation continues for about 10 to 16 days, after which corpus luteum halts or reduces its secretion of progesterone. So there is another sudden change in hormonal levels whereby progesterone drops and estrogen increases. This dramatic drop in progesterone hormone levels causes a woman's period to commence. If she is pregnant, the production of progesterone by corpus luteum will continue, and she won't get her period. Now, for the same reason that a drastic drop in progesterone makes the period to start, a tiny drop in progesterone makes a woman to experience spotting. Having brown discharge during the luteal phase also indicates that a woman is having too low levels of progesterone. Progesterone helps with pregnancy in that it keeps the uterine lining thick and mature to allow the embryo to implant. If the levels of progesterone are particularly too low, a woman can experience a light brown discharge or spotting in luteal phase. The luteal phase that usually takes about 10 to 16 days may be short, say less than 10 days. If you are concerned about having low progesterone levels that are contributing to brown discharge before period, you need to discuss that with your doctor. Having brown discharge prior to periods should not conclusively indicate anything wrong with your health. However, if it occurs consistently, there is every reason to have it checked. Ensure that you have the doctor testing your progesterone levels within the right time in your menstrual cycle. If you have your cycle occurring in 28 days, you can have progesterone tested on day 21 of the cycle. This is when the levels tend to be highest, and ovulation occurs on day 14 of the cycle. In women who ovulate later or earlier than day 14, they should have progesterone levels tested 7 days after they ovulate. Besides the hormonal fluctuations, a woman may experience spotting before period due to implantation of embryo, something known as implantation bleed, miscarriage, postcoital bleeding usually after sex, an ectopic or tubal pregnancy, use of contraceptives, patches and hormonal-based devices, ovulation, hormonal imbalance because of ovarian or thyroid problems and diabetes, side effects of medications like corticosteroids and antidepressants, use of blood-thinning medications like aspirin, warfarin and heparin, polycystic ovarian syndrome, PCOS, conditions like ovarian, uterine, and cervical cancer or polyps, endometriosis, lesions, and fibroids, after a pap smear or other vaginal examination, ongoing stress. If a woman spots in the luteal phase, it is not usually an early indicator of pregnancy. In most cases, it's just because changes in hormone levels are occurring in the menstrual cycle. Luteal phase spotting has nothing to do with embryo implantation. It shouldn't be perceived as an implantation symptom. Most menstrual cycles that end in pregnancy tend to have fewer incidents of bleeding during the luteal phase compared to those that don't end in pregnancy. That said, there are situations where spotting before period is linked to pregnancy. A newly pregnant woman may have spotting occurring before period. This is mainly because of changes in hormones. A pregnancy test may be needed to see if the brown discharge is associated with pregnancy. The doctor can also help determine whether the brown discharge is normal or associated with ectopic pregnancy, which is a medical emergency. Look out for additional warning signs like abdominal cramps, dizziness, shoulder pain and symptoms that are not related to normal pregnancy. In most cases, brown discharge before period is normal. But you may need to consult a doctor if the condition continues for weeks, is accompanied by a foul odor, pain or cramps.
If you have found this video helpful, please like, share and subscribe to the channel, Health Destination.